Hi, my name is Abigail Farmer and I will be presenting on music therapy and Parkinson's disease. So music therapy is a very interesting and rapidly growing field with a lot of untapped potential. The versatility of its application means that it can be used with any number of populations. Today I'd like to specifically focus on the feasibility of implementing music therapy with individuals with Parkinson's disease. So first, it's important to understand what Parkinson's disease is. Parkinson's disease is a neurodegenerative disorder. This means that the neurons in the brain break down gradually over time due to a lack of the neurotransmitter dopamine. This lack of dopamine leads to an individual gradually losing control of their body, their movements, and their emotions. Parkinson's disease can be characterized by symptoms which are split into two categories: motor symptoms and non-motor symptoms. Some motor symptoms include things like tremors and shaking, stiffness in limbs and trunk of the body, difficulty with balance, and a very distinct shuffled walk and uneven gait. Some non-motor symptoms include mood disorders such as depression or anxiety and sleep disorders. It can also include cognitive decline and difficulties with speech, such as muffled speech called hypophonia or very soft speech. Next, it's important to understand what music therapy is. Music therapy is the use of music by a professional to achieve a non-musical goal. A music therapist will have a degree in the field as well as be board certified. Music therapy covers a bunch of different disorders and populations, some of which may include but are not limited to post-traumatic stress disorder, autism spectrum disorder, intellectual developmental disability, and as well as neurodegenerative disorders such as Alzheimer's disease or Parkinson's disease. So now the question is, how can music therapy be used to treat Parkinson's disease? Well, much of the research that I've found and that has been done with these two topics revolves first around the motor symptom of gait regulation. Then the rest focuses mainly on the non-motor symptom of speech and on mood disorders, though with mood disorders there hasn't been many definitive results because there's very little research that has been done so far. So first I'd like to focus on the research on motor symptoms. Now, like we just mentioned, most of this research focuses on the issue of gait regulation. Now, one of the most highly researched topics is a music therapy technique, actually a neurologic music therapy technique, meaning that it's derived from neurobiology, is something called rhythmic auditory stimulation. Now, the rhythmic auditory stimulation is done with a metronome or a beat-centered music. And what will happen is a metronome will be playing. This can be sitting out loud, a metronome earpiece, or a music therapist providing a highly regulated beat with a strum of guitar or a drum. And a client with gait issues, such as a person with Parkinson's disease or someone who has suffered a stroke, will walk to this beat and their body will entrain to the beat. This is rhythmic auditory stimulation. And so this is something that has been proven highly effective in treating and regulating an individual's gait. Another bit of research that I found during the study was expanding upon rhythmic auditory stimulation. Researchers wanted to know whether this can go beyond just a metronome to client-preferred music. So what one study did is they took individuals who are young and healthy and had them listen to their preferred music and just recorded what happened as they walked. around, and they found that individuals gait entrained to even their preferred music. So the implications of this are that almost any music that you'd like can be used to entrain your gait through rhythmic auditory stimulation. And so that's the motor research that I found. Next, I'd like to focus on the non-motor symptoms and the research on those that I found with music therapy and Parkinson's disease. And much of this research focused on affecting the various aspects of speech through other neurologic techniques. Now, what I found is that the first study that I found utilized two neurologic techniques. The first one is called vocal intonation therapy, and this involves a lot of the physical aspects of speech, such as jaw exercises to strengthen the jaws used to speak, as well as breathing exercises to be able to control breath as well, and breath support, as well as to control the volume of one's voice. And the next bit of neurologic music therapy that was used in this study, it was therapeutic singing. Therapeutic singing was used to improve the clarity and articulation and accuracy of an individual's speech. And the example that was used in the study I found used the song "Take Me Out to the Ball Game," where they put the emphasis on the T and the K, so it would sound more like "Take me out to the ball game." And overall, at the end of this research, it concluded that there was a statistically significant increase and improvement in the individual's vocal prosody, which is the inflection with which they spoke, and in the volume, clarity, and articulation. And another method of music therapy that was used is something called Group Music Therapy Voice Protocol, which is just a combination of VIT and TS. So in conclusion, my research found that the aspect of Parkinson's disease that was most benefited by music therapy treatment was gait regulation. And while that's currently being used, something that I also found was that speech and all the aspects of speech were helped by music therapy and neurologic music therapy treatments. So my recommendations for the application of these findings are that music therapy be used more frequently with speech, as well as, of course, continued research to further support these findings. Thank you.